IL-22 is emerging as more than just a helpful cytokine in gut repair. It may be one of the most promising biomarkers for early detection of intestinal compromise, immune imbalance, and long-term disease risk. Traditionally, gut health assessment has relied on symptom-based checklists, invasive colonoscopies, or broad-spectrum inflammatory markers like C-reactive protein, CRP. But these tools often miss the early stages of dysfunction, especially in healthy individuals whose disease has not yet crossed the diagnostic threshold. That's where IL-22 steps in, not just as a participant in gut immunity, but as a potential predictor of when things are beginning to unravel. Produced primarily by innate lymphoid cells, ILC3S, Th17 cells, and epithelial-associated immune populations, IL-22 is intimately tied to the maintenance of mucosal integrity. It promotes tight junction formation, stimulates mucus production, and induces antimicrobial peptides, all essential features of a healthy gut barrier. Importantly, IL-22 is highly localized. It acts at barrier sites like the intestines, lungs, and skin, and is rarely elevated systemically unless there's a breach or inflammatory disturbance in those regions. That specificity makes it an unusually precise indicator of what's happening at the gut lining itself, rather than somewhere downstream. What makes IL-22 particularly attractive as a biomarker is that it drops early, often before overt signs of inflammation or disease. In animal models, exposure to high-fat diets, alcohol, or antibiotic stress leads to a reduction in IL-22 signaling well before overt leaky gut, dysbiosis, or metabolic syndrome are clinically visible. In humans, studies have found that individuals with low mucosal IL-22 expression tend to show greater gut permeability, increased microbial translocation, as measured by circulating LPS, and elevated systemic inflammatory markers, even in the absence of diagnosed gastrointestinal disease. This positions IL-22 as a potential early warning system. In healthy populations, low serum or fecal IL-22 levels, particularly when paired with other markers like LBP, lipopolysaccharide-binding protein, zonulin, or fecal calprotectin, could help identify individuals at high risk for developing metabolic disease, autoimmune disorders, or inflammatory bowel conditions. For instance, in people with a family history of Crohn's or ulcerative colitis, IL-22 could function as a preclinical marker of mucosal immune drift, long before structural changes appear on endoscopy. In metabolic syndrome, IL-22 suppression may flag the presence of gut-derived low-grade inflammation that is driving insulin resistance or hepatic fat accumulation. Importantly, IL-22 is not just a marker of damage, it is a marker of resilience. High IL-22 levels tend to correlate with strong epithelial repair capacity, robust microbial balance, and successful immune tolerance. In this way, tracking IL-22 over time could help assess the effectiveness of interventions like high-fiber diets, polyphenol supplementation, probiotic therapy, or lifestyle modifications. In clinical trials, restoring IL-22 signaling has been associated with improved outcomes in colitis, liver injury, and even metabolic inflammation, further cementing its dual role as both a signal and a solution. However, there are practical challenges. IL-22 is tightly regulated and often present at low levels in peripheral blood, making accurate measurement difficult without highly sensitive assays. Local sampling via mucosal biopsy or stool cytokine analysis may provide more consistent data, but is not yet standard practice. Furthermore, because IL-22 can also play a role in tumorigenesis in certain contexts, such as chronic inflammation-driven colon cancer, interpretation must be careful and context-dependent. The goal is not to universally boost IL-22, but to monitor its appropriateness and responsiveness in specific situations. Despite these caveats, IL-22 holds real promise as a next-generation biomarker for gut health, not just as a snapshot, but as a dynamic gauge of mucosal integrity, immune coordination, and microbial symbiosis. In a healthcare system that still struggles to detect gut dysfunction before it explodes into disease, IL-22 could provide the early signal we've been missing, one that speaks the language of the gut long before symptoms do.